I'm Julie Bartkey with Session Update. Proclaiming April to be Autism Awareness Month, Governor Mark Dayton helped raise awareness of the issue, and he wasted no time in a news conference to explain why he thinks there is a gap with insurance coverage that needs to be closed.
That's the whole problem with one of the major problems with our private insurance system in Minnesota and across this country. You know, young families, when you go from being a young single person to being a young married couple, and then you start to have children, that's often when individuals make a decision to not have health coverage because they're trusting they won't get sick and it's expensive, to having coverage for their family, especially their children. And I don't think anybody knows when before the children are born, you know, what medical treatment they may need in their years, nor do we know what we need ourselves. So you get a situation where you buy a health insurance policy and you're paying into that policy and you assume that that means you're covered for what happens to you and your family. And then when it happens, if it happens, the insurance companies bail out. You know, they're not such good neighbors when it's their turn to pay for services. And the other factor is that the interlock of these public-private coverages, private insurance, medical assistance, which we're proposing to increase funding for early intervention in autism, but to access that program, if you're on private insurance, and you know, I mean, you have to have PhDs in government practices, which I wouldn't want to force on anybody. So I've sent a letter today, signed a letter that goes to the director of the CMS in Washington, urging that the basic plan for Minnesota include autism treatment services. I will support Senator Pappas's legislation to bring about a state requirement that insurance companies have to provide these services. And you know, those who say that we shouldn't be mandating these of the private insurance companies need to look at stories like this one, where somebody just gets arbitrarily cut off on July 2013. Their expenses continue. The insurance companies just decide, well, we're not going to pay for it.
2013 marks a decade of autism for our family, as it has been 10 years since my son Elliot's diagnosis. I will never forget that day, walking out of the clinic with my sweet little boy, holding a piece of paper that would change our world forever. It was just as painful 5 years later when our lovely little girl started exhibiting some of the same early warning signs that were all too familiar to us. What I remember most was the isolation that we felt and the parental guilt that we had for not knowing instinctually how to help our children. While we have faced many challenges through the years, we are very lucky. Our children were diagnosed early, and we have been able to do intensive behavioral therapy programs for both Elliot and Ada, which have been life-changing for our family and given our children the opportunity to live happier, healthier lives. This year, more children will be diagnosed with autism than with AIDS, diabetes, and pediatric cancer combined. Families will be overwhelmed, siblings will be impacted, marriages will be strained. Yet, autism receives less than 0.3% of NIH funding. The face of autism is changing. Children grow up to be adults, and in the next 10 years, we have a wave of young people with an array of strengths and challenges that are coming of age. Currently, there is 81% unemployment among adults with autism. I believe we can do better.
Minnesotans are asked to shine a blue light Tuesday night in support of those with autism. You can follow the work of Senate Media Services, including many of our news conferences, online by following our YouTube, Facebook, and Twitter accounts.